And did you think about from an early stage that you might eventually want to be on the administrative side of healthcare, or was it more evolutionary?
It was really just various taps on the shoulder. Hey, can you help with this project? Can you help with this? And then, it's sort of the projects kept getting a little bit bigger and a little bit more complex. So I never had planned or even
Hmm.
dreamed of going into
Right.
administration.
I know that feeling. Hello, everyone. I'm Jim Ryan, president of the University of Virginia, and I'd like to welcome all of you to another episode of Inside UVA. This podcast is a chance for me to speak with some of the amazing people at the university and to learn more about what they do and who they are. My hope is that listeners will ultimately have a better understanding of how UVA works and a deeper appreciation of the remarkably talented and dedicated people who make UVA the institution it is. I'm joined today by Wendy Horton, the Chief Executive Officer of the University of Virginia Medical Center. In her nearly 4 years at UVA, Wendy has stewarded the medical center through the unprecedented coronavirus pandemic. In collaboration with Dr. Craig Kent and his leadership team, she helped craft the first 10-year strategic plan in the history of the health system and is well into the hard work of executing on that plan. Wendy earned a Doctor of Pharmacy from the University of Utah and a Master of Business Administration from the University of Wisconsin in Madison. She is a fellow with the American College of Healthcare Executives and last year was named to Modern Healthcare's list of top 25 women leaders in healthcare. Wendy is a trailblazer and a dedicated leader, indeed one of the most important leaders at UVA today. And we are incredibly fortunate to have her on the podcast. Wendy, thank you for being here.
Well, thank you.
So, like Dr. Kent, you started at UVA Health right around the same time COVID hit in March of 2020, and you came here as Chief Operating Officer. I'm assuming that made your start simple. And I wonder if you could walk through what was your first month like?
Sure, totally seamless, textbook, the first 90 days.
Yeah.
I remember I came to UVA a month before I was supposed to start. So I was supposed to start in April, and I actually started in March because I was calling and kind of making arrangements of starting. And I learned that we had 2 days of PPE on hand at the hospital. And that was a little bit frightening. And I thought, oh, maybe I just need to get there and get started early. So I started a month early. And, when I came, there wasn't traditional meet and greets, but it was, hand sanitizer and
Right.
What are we going to do for the students and all kinds of fun things. It was a great time, actually, because I got to know so many parts of the university and to call people. And I just remember we were very united as a university as well.
Right. And what was the biggest challenge that you faced early on?
I think early on it was a lot of fear. So we didn't know a lot of information.
Yeah.
And so we were helping people and taking care of people the best way that we knew how. But what I remember most is talking to the community and trying to make plans for not only the academic medical center, but, how we were going to vaccinate and how we were
Right.
going to, take care of students and, what plans that we were going to do kind of community wide.
Yeah, I mean, it drove home the fact that the university and the community are inextricably linked, for sure. When you look back on that time period, not just your first month, but dealing with COVID generally, what stands out? What are you most proud of?
I'm most proud of, I remember the day that I met with some community members and, we were talking about vaccination then and how many people were available to vaccinate the community. And it was this moment that I came back to the office and I thought, wow, UVA is going to have to find a way to help partner to vaccinate the community. And it was at that moment a really important way for people to stay safe and, the next thing that we can do. And I just remember that moment of that partnership. How are we going to work together? What are we going to do? Where are we going to do it? All these logistic things. But the moment of, being a large employer, being really a big piece of the community, and then being that good neighbor was so important in COVID.
Yeah, I remember going up to the old Big Lots store for one of the vaccination clinics, and was incredibly impressed by how quickly it was set up and how well it was operating. And someone said, and this was an incredible compliment, this place runs more efficiently than Chick-fil-A.
That is the best compliment.
All right, so let's step back a little bit. You grew up in California, right?
Yeah, Southern California.
Okay. Where exactly? And tell us a little bit about your childhood.
Sure. I grew up in a small town in Southern California called Banning. It's next to Palm Springs,
Hmm.
and it's towards the desert, so very different than Charlottesville. About the same size though,
Right.
and it's a community where my whole family, born and raised, so my
Hmm.
grandparents, both sets of my grandparents, my parents, my brother lives there, and so no one has ever left except for me.
So I remember the moment that I decided I didn't want to be a pharmacist. I was watching It's a Wonderful Life, and there's a scene where George Bailey prevents the pharmacist from basically giving poison to someone. The pharmacist had been drinking because he was mourning the loss of his wife. And I thought, I really do not want to be a pharmacist. I'm wondering if you remember the moment when you decided you did want to be a pharmacist.
Yeah, it was a moment. I was a exchange student, and I was an exchange student in Australia. And part of going to school, I was in the 10th grade, 15 years old, and part of going to school there was deciding if you were going to do an apprenticeship model or if you were going to go on to what they called uni. And so you had to do all these job shadows. And so one of them was in a corner drugstore where at the
Hmm.
time you could not buy ibuprofen or anything. There was a butcher and a bakery and a pharmacy. And so I rotated through the pharmacy and was absolutely enamored by the leadership of the
Huh.
pharmacists, and what they did in the community. And I think it was that moment I knew I wanted to be a pharmacist.
No kidding. As a 10th grader.
Yeah, never looked
Um,
back.
and what was it exactly about being a pharmacist that was so attractive?
At the time, I think it was the leadership qualities of that pharmacist that really showed me what an important role they played in the community, from everything from counseling to blood pressure regulation to
Hmm.
really saving people, and the drug interactions, and that's part of it. But most importantly, how respected they were within the community and how many people
Right.
came to ask for advice, which was just really wonderful.
Oh, interesting. So you went off to college and you got a Bachelor of Science in pharmacy, if I'm remembering correctly.
Mhm.
What led you to go on to get a doctor in pharmacy?
That's a good question. It was kind of right in the midst of things changing for pharmacy. So, the bachelor's was phasing out or would be in the years to come. And so I thought it was really important. And I didn't have a lot of upbringing in healthcare. So no other family members in healthcare,
Right.
and really wanted to strengthen my education. And so, I was working, but also wanted to really further my education in that space, and really become a little bit more subspecialized in certain areas.
And did you think about from an early stage that you might eventually want to be on the administrative side of healthcare? I mean, are you one of these people who had a life plan? So you would be a practicing pharmacist, you'd get your doctorate, and then you'd eventually move into healthcare administration, or was it more evolutionary?
Totally evolutionary. And, I was really happy as a pharmacist, very clinically strong, loved it, love working with patients. The mission of healthcare really rang true to me. And I loved helping patients. I was board certified, doing all the things in the societies. And it was really just various taps on the shoulder. Hey, can you help with this project? Can you help with this? And then, it's sort of the projects kept getting a little bit bigger and a little bit more complex. And it was, a little bit at a time. So I never had planned or even
Hmm.
dreamed of going into
Right.
administration.
I know that feeling. So, what brought you to UVA?
I was not honestly planning to come to UVA.
Hmm.
And I had never been to Virginia. And I knew I wanted to be a chief operating officer. And so
Yeah.
I had interviewed a couple places, but I will tell you, it was It was the people
Hmm.
that is the reason why I came to UVA. I think really incredibly talented people all throughout UVA, but especially within UVA Health and the medical center, and world-renowned people that are just very humble. And you
Right.
come here, and they want to help other people and each other, and it's a really special place.
Yeah, I agree. So you came here as chief operating officer. What does that entail?
So, chief operating officer at the time, during COVID, was really helping. And if you remember, it was every day protocols were changing. We
Right.
were figuring it out. And so it was operationalizing and implementing all of that. In addition, it was a time where throughout the state, different services were being shuttered. And so at a point in time, our elective surgeries were shut down. And so constantly learning how to pivot, what was needed in the organization, and really just serving the most acute needs of the institution at the time.
And not too long after you arrived, you went from being COO to CEO, meaning
Mhm.
you're in charge of the medical center. Was that an enormous leap, or was it just a slightly bigger job?
It was enormous at the time
Yeah.
because I had come early, and that first week, the CEO had stepped down, and so that was a big change coming into the institution. And at the time, there was people were not traveling, people were not visiting. There
Right.
was no way to backfill my role, and so we really did a whole team of us pulled together,
Right.
and we really worked hard to cover all the bases during that time. So it was an incredible journey, but I would say almost the best of times because we were focused, and I really got to work with, the very front lines, getting to know the institution, the university, and it was in some ways magical times because you roll up your sleeves, you work together, and you're doing the task at
Right.
hand for the day. And so in many, many ways, I loved the teamwork. I loved getting to know people in a very authentic way. And so in
Yeah.
many ways, I cherish those times.
You and your team and all the doctors and nurses and other team members were just an incredible inspiration throughout. I'm wondering if you can walk us through a day in the life of a CEO of an academic medical center.
Well, typically it's an early morning, and you start with kind of an assessment of how things went the night before. And I think that's one thing that maybe not everyone thinks about is, we're 24/7 business.
Right.
And so a lot can happen overnight. And so, you're assessing, or sometimes you get called in the middle of the night of if something's happening or going on. And so, how are you doing? Are we on task? How's the operating room? How's the emergency department? How many beds do we have? How much staff do we have? All the things that could change or pivot your plan for the day. And so kind of just making sure that everything's in order, everybody has what they need to really have a successful day. And what I love is as a leadership team and all throughout the institution, we come together at 10 o'clock every day. So we
Mhm.
get the morning started, and then we check in with each other and kind of go through our biggest vitals and making sure everyone has what they need for the day. And then we continue. I love my day. I have a full calendar, but I would say that oftentimes my calendar gets blown up. And so you have to be a person that's very nimble, very willing
Right.
to go with the flow because every day is so unique. The needs are different. Patients and families have unique needs. Things happen. And so you're constantly, pivoting, adjusting to meet the needs of patient care and that demand, but also planning for the future at the same time, which is a lot of fun.
Right. It seems like a lot.
It is a lot. I think your job's a lot.
What part of your job do you love the most, and which part is the most challenging?
I love the mission of healthcare.
Yeah.
I love seeing patients and families. Sometimes they're at their most vulnerable,
Yeah.
and you get to see miracles happen. You walk with them in their shoes. They entrust you with their care. And it's really special moments. It can be very stressful for patients and families. and you're with them and part of their family for this unique time in their life. So I love that piece of it, the connection, and it really makes a difference in people's lives. And so that's very, very rewarding. I would say the most challenging is sometimes miracles are happening, sometimes people are dying, the hours are long. I think it's really keeping yourself well in check, the stress under key, because you're setting the tone and the pace for a large workforce and
Right.
and making sure people have what they need to be successful.
What are some things that you now know about running a hospital or working in a hospital that people who don't have your experience or aren't privy to what you see day in and day out, what should the rest of us know?
Sometimes it can be little things. Like we're kind of a mini city if you think about it. So if there's a snowstorm and we don't get a delivery truck at 4:30, we know that's going to be a problem. Or if our trash doesn't get taken out, or if we don't have water, these are our major components to running a hospital, making sure. So it's all these little things that you never really think of as big things, but if something goes wrong with key infrastructure, could be really important, or, how the ORs work and the ventilation. And so there's a lot of facility components. There's a lot of infrastructure, and then there's a lot of just the way that a patient flows through the system. So if we have a backlog in an area or our emergency department isn't optimized, all of this is going to clog up various areas and the throughput of the institution. And so that's really important to make sure that we're getting all the different teams working together, communicating together, and helping one another out. And that's key to us having various touch points throughout the day to make sure everyone has what they need to care for patients.
And do you have mentors that you rely on? I'm sure that you have, I know you have, in your short time become a role model for many. And I know that you mentor many other people. Who are your mentors?
My mentors are a lot of different people. I would say I have like an advisory council of mentors, if you will. And, I'm going to a cadre of people asking for advice and helping people. We have this situation. What have you tried to other CEOs across the country, to other people within the university, seeking counsel with a variety of individuals. Sometimes you can get too close to things and having people help you think through or ask questions, from a broader perspective is so helpful. So I would say that I have a lot of CEO colleagues that we're texting and emailing and spending time together. And it's amazing. Sometimes our situations are very similar and sometimes unique to the institution.
So thinking more broadly, what are some of the biggest challenges for healthcare in general, or what are some of the most promising things to come that are on the horizon for healthcare?
Yeah, I would say coming out of the pandemic, workforce was a major issue and making sure that people were really well. And so we've spent a lot of time at UVA, and I think we've done a great job of making sure that we've prioritized wellness and that we're building for the future. So inspiring the next generation to go into healthcare, to make sure that we have pipeline programs and services that we're going to have healthcare workers is really key. I would say lately, within the last couple of years, inflation, compensation, finances were also a big theme. And I think UVA has done an extraordinary job in both of these areas. And I would say that we're really strong as a health system. And I think it's because we've really invested and thought a lot about these two areas, which have really well positioned us throughout the Commonwealth.
And can you talk a little bit about what is special about an academic medical center as opposed to a hospital that is freestanding?
Yes. And I think this is key. This is the piece that I love. I just love the innovation. If you're working in a community medical center, the research, the teaching component may not be there. But at an academic medical center, you have all four missions, really thinking about the clinical care, the research, the education, and then also our community. And together, these really make such a big difference. And so today, the innovations and the discoveries and the research is really fueling the advanced treatments that we can provide. So just in the short time that I've been at UVA, I remember CAR T cells, we could only give it in an inpatient setting. And just this last couple of weeks, through technology advancements, we're now able to give some of that therapy on an outpatient basis. And likewise, some of the orthopedic surgery that used to take days and days of recovery now are being done in our new orthopedic facility and going home the very same day. So it's just incredible to see the innovation.
Yeah, I bet. So last question. I understand you're involved in the American College of Healthcare Executives, which is the largest executive association in healthcare. Can you talk a little bit about this organization and your role in it?
Sure.
This seems like a big deal to me.
Well, the American College of Healthcare Executives is an organization of about 48,000 individuals across the nation and the world, and a lot of military as well. And they are really the premier organization for healthcare executives. And, just so honored because recently I was selected to be on the board of regents and the board of governors. And the board of governors is what stewards the organization. And so it's quite an honor for me as an individual, and I think for UVA as well, to be represented as a board of governors for the American College of Healthcare Executives.
Well, congratulations on that. And they are very lucky to have you.
Well, thank you.
Wendy, this has been terrific to get a chance to talk with you. Thanks for everything you do for UVA and in particular for the patients who are lucky enough to cross your path.
Thank you so very much.
Inside UVA is a production of WTJU 91.1 FM and the Office of the President at the University of Virginia. Inside UVA is produced by Jaden Evans, Ariane Ballou, Mary Gardner-McGee, and Matt Weber. Special thanks to Maria Jones and McGregor McCants. Our music is Turning to You from Blue Dot Sessions. You can listen and subscribe to Inside UVA on Apple Podcasts, Spotify, or wherever you get your podcasts. We'll be back soon with another conversation about the life of the university.